All right, so we're at 12:01 and we'll go ahead and get started. So thank you everybody for joining and welcome to the UCSF Share, Trust, Organized Partner COVID-19 California Alliance, also known as Stop COVID, funded by the NIH Community Engagement Alliance Against COVID-19 Disparities. My name is Abby Cabrera and I am the UCSF Stop COVID Project Manager and work in the Center for Excellence in Primary Care at UCSF. We will be sharing our findings and recommendations around our fourth practice and policy brief, understanding why more Black, Latinx, and Samoan young adults aren't getting vaccinated. I'd like to recognize our co-investigators and community partners on this project, NICOS Chinese Health Coalition, Instituto Familiar de la Raza, Rafiki Coalition for Health and Wellness, and faculty and staff from UCSF. Please note this webinar is being recorded. And today you'll hear from some members of the UCSF Stop COVID team, present our findings and participate in a panel discussion. We encourage you all to submit questions in the Q&A feature below. The Young Adults Project is part of a larger effort that began in January 2021, where we aim to develop, based on the learnings of our community-based participatory research project, best practices for culturally tailored outreach strategies informed by community members and co-created with community partners that facilitate respectful, informed decision-making about the COVID-19 vaccine. We held focus groups and interviews with communities of color from January to March 2021, prior to the availability of the COVID vaccine to the general public in April 2021. The findings and recommendations from that period can be found on our practice and policy briefs number 1 through 3. And you can find them on our community partners website that is listed below, rafikicoalition.org. So following the dissemination of our 3 briefs in May 2021 and the increased access to the COVID vaccine for individuals ages 12 and above, we decided to explore the perceptions and views as to why younger adults ages 18 to 30 were not getting vaccinated. Our first round of focus groups focused on Black African American, Latinx, and Chinese American community members. And we were interested in including more members of the Pacific Islander community. Our community partner, NICOS Chinese Health Coalition, partnered with the Samoan Community Development Center to recruit young adults for our focus groups. And we'd like to thank the Executive Director, Patsy Tito, as well as our leaders from NICOS Chinese Health Coalition for facilitating that. So what we would like to do today is present with you perspectives that we think are unique to this age group, as we did hear other perspectives reiterated, reflected in our previous briefs. So next, I'd like to introduce my colleague, Mariam Carson. Mariam joined UCSF as a project and policy analyst after graduating from UCSF in 2021 with a master's in global health. She's heavily involved in San Francisco's COVID-19 response efforts, both as a researcher and as a disaster service EMT with the San Francisco Department of Public Health. Mariam supports the UCSF Latinx Center of Excellence and the Clinical and Translational Sciences Institute by participating in community-based research and outreach. Mariam.
Good afternoon, everyone, and thank you all for joining us. I'm going to move into the methods and results of this project, where I'll highlight the key takeaways from our focus group discussions. So this is just a quick overview of how we brainstorm. This is from a platform called Jamboard. So all of the sticky notes you see are notes that people added to the board during our group meetings. Each sticky note contains a theme or a takeaway from the focus group. So for example, the green note in the center quotes a participant saying, "I'll get the vaccine if I have to for work." And below that, it's easier to find and retain work if vaccinated. These sticky notes were then organized into overarching themes, which we then used to develop our key findings. Overall, we spoke with 18 Latinx, 13 Asian American and Pacific Islander, and 15 African American young adults between the ages of 18 and 30 for a total of 46 participants. We conducted a total of 7 focus groups with 2 Latinx groups, 2 African American groups, and 2 API groups, as well as 1 multi-ethnic group. Next slide, please. Our first key takeaway centers around trustworthiness and skepticism. Young adult skepticisms about the trustworthiness of health and science institutions is anchored in a broader critical appraisal of society's failure to dismantle structural racism and promote a just world. Our participants were incredibly articulate in citing the reasons for mistrusting academic and healthcare institutions and the government, ranging from personal negative experiences with healthcare providers to contemporary neglect by the government. Here, a participant calls out medical racism by highlighting the historical injustices inflicted upon people of color by medical institutions, saying it's no wonder we're going to have trust issues related to this random vaccine created by a huge pharmaceutical company. Next slide. The second theme focuses on misinformation and disinformation, particularly by social media. Our young adult participants primarily relied on social media for their source of information about COVID-19 vaccines. While they recognize that these platforms are filled with misinformation and conflicting theories about the vaccines, participants cited accessibility and ease of use as reasons for using social media. One participant highlighted this tension by explaining the misinformation a lot of times is through social media, which is kind of funny because for me, it's a big place where I get news and what's going on in the world. Participants also noted the prominent presence of social media in young adult culture. For example, one adult mentioned that they didn't have time to sit around and watch Anthony Fauci on TV, but that they can easily use their phone to surf the internet while on the go. Next slide. Our third theme centered around young adults' motivations for getting vaccinated. Similar to older participants we interviewed earlier in the year, young adults were motivated to get vaccinated to protect the health of their older family and community members. Compared to older adults, however, our young adult participants placed a much stronger emphasis on the social benefits of vaccination, including travel, attending sports events, and even going out to eat. As these participants quoted here, they said that they want to live their life outside of the house. Young adults also emphasized the stress they felt due to increased financial responsibility caused by economic hardship during the pandemic. Participants felt very stressed and very overwhelmed by their new role as providers for their families. And in these cases, participants were motivated to get vaccinated so that they could return to work and provide for their loved ones while their older family members stayed at home. Next slide. Finally, participants expressed a very strong desire for self-agency and autonomy, especially surrounding healthcare decision-making. For example, when a vaccinated individual was asked whether she would do anything to persuade her peers and colleagues to get vaccinated, she replied, "For me personally, I've never tried to convince anybody to get the vaccination. That's honestly a personal preference and not anything I would want to force on anybody else." This theme is especially important when considering the rise in vaccine mandates. Participants generally were against vaccine mandates, with one participant saying, "I think the incentives definitely make me more hesitant to want to get the vaccine." And another saying, "I don't think that they should be forced down people's throats, especially if healthcare isn't accessible to everybody in our society." This suggests that while vaccine mandates might incentivize some people to return to work and provide economically for their families, the mandates might not do enough to address deep-seated mistrust that some young adults harbor towards people in the government, as well as medical and research institutions. In some cases, mandates may even exacerbate this mistrust. Next slide. Based on the main themes we uncovered, we developed 4 main recommendations to increase vaccine uptake among young adults in communities of color. The first recommendation is that when talking to young adults about COVID-19 vaccines, be prepared to talk about what you and your organizations are doing more broadly to achieve health equity. Young adults want institutions to demonstrate systemic action and social investments rather than shy away from them. These actions are overdue and required to rectify social injustice. It's also important to recognize that vaccine mandates might backfire as they perpetuate loss of choice and personal freedom for young adults. The second recommendation is to emphasize the non-health benefits of getting vaccinated. Public health messaging should surround benefits related to employment, education, and recreation. Our third recommendation is to sponsor and amplify pro-vaccination social media influencers who are generationally relevant for young adults. Even though social media has its drawbacks with misinformation, its ubiquity among young adults means that we must leverage its presence to reach this audience. We must counter misinformation with evidence-based data that are easily accessible and reliable for young adults to recognize and trust. One way to do this is to leverage celebrities and social media influencers with whom young adults connect, rather than relying heavily on trust the science messaging from older scientists and physicians. Finally, we must center young adults from communities of color in creating and disseminating vaccination messaging. Young adults are best positioned to know how to reach and influence their peers. Their unique perspective on the concerns and needs of this group is paramount to informing vaccination and public health campaigns. This is especially important for navigating the complex relationship between vaccine mandates and self-agency, especially as mandates increase in prevalence and are now considered necessary for achieving vaccination goals. Public health campaigns should engage with and invest in leaders from this generation to tackle issues of deep-seated mistrust and prepare for future public health emergencies. Next slide. Before we move into the panel portion of this webinar, we want to address several limitations in this study. First, the nature of qualitative interviews and our sample size means that it is difficult to generalize our findings outside of the communities in San Francisco. Second, our policy brief only includes high-level conclusions drawn from general focus group perceptions. There were some differing opinions within each racial ethnic group, especially within our API participants. For example, while Southeast Asian American participants expressed general trust in COVID-19 vaccines and were for the most part vaccinated, Samoan American participants expressed beliefs and attitudes that were similar to our African American and Latinx participants. This difference highlights the importance of disaggregation within racial ethnic groups, especially within the API community. It also demonstrates that a one-size-fits-all vaccination campaign will not work, and that cultural concordance is paramount to connecting with communities of color and establishing trust. In addition to data disaggregation, the temporal difference between our young adult interviews, which were conducted over the summer, and our adult interviews, which were conducted at the beginning of the year, make comparisons between the two groups more difficult. Vaccines were much more widely available by the time we interviewed our young adult participants. So therefore, while interviews conducted between January and March revealed barriers to vaccine access, such as language concordance and technology discordance, interviews conducted between June and August revealed that more barriers were related to vaccine uptake. Despite these limitations, we feel that our policy brief serves as a starting point for public health institutions to engage with young adults and communities of color. Understanding their motivations and deterrence for vaccination is paramount to developing strategies to increase vaccine uptake in these communities. Next slide. This is a copy of our policy brief that we wanted to show with everyone. I believe Abby shared a link to this policy brief earlier in our presentation, and we have our key findings here paired with illustrative quotes in the dark blue boxes, and then our recommendations are listed in the orange box. Next slide. Now we're going to move into the panel portion of this webinar, which will be hosted by Francine Rios-Fetchko. Francine is a research analyst at the UCSF Latinx Center of Excellence with a BA in political science from Yale University. She has worked in community-based research, education, and outreach for the past year and a half and is pursuing a medical career focused on caring for vulnerable populations and promoting health equity. She aims to use research as a tool to better guide direct community engagement and political action.
Thanks so much, Mimi, for that background and for the introduction as well. Again, I'd like to welcome everybody who's joined us throughout this. We're going to move to our panel portion now, and I'd encourage everybody to put questions in the Q&A, and I'll start us off with a few, but we aim to get to as many audience questions as possible as well. So just to start off the panel, I'd like to introduce our three amazing panelists that we have today. The first is Kirsten Liu. Kirsten is a Master of Social Welfare candidate at the University of California, Berkeley. She is passionate about breaking down institutional inequalities by promoting and implementing policies and programs that support marginalized populations, especially communities of color. Welcome, Kirsten. Next, I'd like to introduce Randi Ellis. Randi is the Health and Wellness Manager for Rafiki Coalition for Health and Wellness. Her studies focus on public health and health equity, and she strives to diminish health care disparities and improve overall health outcomes and engage in innovative ways to promote healthy behaviors. Welcome, Randi. And lastly, I'd like to introduce Roberto Ariel Vargas, who's the Associate Director of the Center for Community Engagement and Senior Staff for the Community Engagement Program of the Clinical and Translational Science Institute of UCSF. Roberto has worked to build community university partnerships with UCSF as a community partner and later staff for 20 years. He is a native of the Mission District and lived and worked in the Bayview community half his life. He is committed to dismantling systemic oppression, especially at UCSF. So thank you everybody for being here. Welcome Kirsten, Randi, and Roberto. And I'd like to start us off with a few questions just about our findings. So the first thing I'd like to talk about is, looking at what we learned and found from this specific age group, our 18 to 30-year-olds. How do our findings from these focus groups compare to our findings from our previous adult or older adult focus groups that we did at the beginning of this year? And so just to start us off talking about that comparison, I'd like to go to Kirsten.
Thank you, and it's pretty great to be here today. So I did find a lot of difference when compared to this age group compared to early focus group, because when we were on early focus group, we focuses more on Chinese Americans, while this group is more on the Southeast Asians and Samoans community members, and majority of the participants are Samoan community members. And I find three unique difference when we do the comparisons. So first of all, like in this age group, they focuses more on their own feeling, like versus like they feel like they need to take the responsibilities, or like they do it because they want it, instead of like I do it because I have to. So that is the main difference. Why in early focus group, they focuses more on I do it because I want to protect our community or protect our family. So that's the main difference. I also realized that in this transition age youth group, they have less emphasis on trusting data released from official agencies such as like DPH or like CDC, but they trust more on social media, which is like pretty understandable because they were born in the information era, and social media kind of like the way they connect to the world, or they get the information from the world. The third unique way I feel like their attitude toward the vaccine is more laissez-faire. So they will feel like if following the COVID protocol can protect me from getting the COVID, why do I still need to get the vaccine? Which is different when we have the focus group with the Chinese Americans, because their attitude toward the vaccine is more positive as long as their concerns is addressed. But in this age groups, they will feel like, oh, if we follow the protocol and it works, then why do we still need to do it?
Yeah, thank you so much for that insight, Kirsten. Just to talk a little bit more about the differences between the young adults and our older adults, Randi, would you mind speaking on that?
Yeah, of course. Good afternoon, everyone. Thank you so much for having me here today. So there were actually a lot of similarities amongst all of the different age groups and different focus groups that we did conduct. One thing that I would like to highlight that was different, but this idea was brought up in all of the focus groups. So for the young adult focus groups, there was a lot more emphasis on social media, definitely, which I'm sure we will dive into more later. Social media does play a huge role in our young adult folks and how they receive their information, as well as other forms of media, such as TV shows, for example. And also there was an emphasis on wanting to travel and be back with friends and get back to doing a lot of the social things that was taken away from a lot of everyone, but especially the young adults. As in comparison to some of our other focus groups, the conversation was based a little bit more on really wanting to protect each other, protect their households, protect their families, and protect the elders especially. I think it's also important to note, as mentioned earlier in the PowerPoint, the difference in the state of COVID between our first set of focus groups and the focus groups that we conducted amongst our young adults. The conversation kind of centered a little bit around it wasn't accessible to everyone yet. And so there were a handful of participants who still had questions and a little bit of concerns, but were ready to get the vaccine. It just wasn't accessible to them yet. Versus now, when we conducted the focus groups for our young adults, a lot of our participants seemed to feel harassed and seemed that it was forced upon them. And it was more of a question of they were wanting answers. it wasn't really an issue for them to find a location to go receive the vaccine, since they felt like it was offered everywhere they turned. It was all over the media, and it was kind of hard to get away from it.
Yeah, thank you so much, Randi. And thanks for really bringing out that difference in the motivators between the young adults and the older adults, because I think that that's one of the most interesting points, thinking about, maybe they're not as worried about their own health, but are more interested in returning to normal life in terms of social activities and traveling. So that was a really interesting point. Roberto, anything you'd like to add again about the differences between these focus groups and the ones that we did earlier in the year?
Yes, sure. Thank you. I think another interesting finding for us was given, particularly for young folks who were teenagers or still in their very early 20s, the idea that they just went through a very formative time as first-time voters, right? And having just gone through an election that was questioned by our own president, right? Having just gone through a moment of political history where our own president was telling folks that they couldn't trust what's in the news. We heard so much distrust for mainstream media sources, right? Which led to a lot of folks telling us, a lot of young folks telling us that the way they confirmed the veracity of a statement being made on social media was by how many likes there were, right? How many or how many comments there were. That from their perspective, a lot of folks seem to reflect that if I can't trust the mainstream media, I'm relying on social media, which was also, I think that was another difference for this younger set of folks, is they relied much more heavily on social media sources for their information. The way they often told us they fact check or could decide whether a source was credible or not was the number of likes and comments. And then they would dive into the comments and see if they agreed with what folks were saying generally. So as Mariam discussed earlier, it's disturbing to understand that there's such easy diffusion of disinformation by way of social media, but at the same time, given its very critical, given that it's a very critical source of information for young folks in particular, we do have to figure out ways of engaging with young folks so that they have access to great information and they're able to share that good information in ways that are engaging to other young folks. I know that one of our colleagues, Brittany Doyle, by way of her work with Black Health Initiative at UCSF, has helped develop some social media presentations of our findings and our recommendations. Seems like it's really simple, but it's actually very powerful in the way that they've been delivering our findings and recommendations on Instagram. And I think it's just one example of what can be done to help us, utilize those sources of those platforms for information.
Yeah, thank you so much, Roberto. And you're actually leading me right into the next question. And I'm interested in what all three of you have to say about the ways in which we can leverage social media because of the importance and prominence it plays in young adult lives, while also recognizing the fact that it is a huge source of mis and disinformation. And sort of, I'd like to hear each of you speak on how to kind of balance those two things and how you and your organizations can use social media in a positive way in moving forward. And I'm actually going to ping it right back to you, Roberto, because you were already on that train of thought.
Yeah, I would just say, I have learned so much from you, Francine, Randi, Kirsten, Abby, Mimi, all the young folks on our team have really taught me, and I think a lot of us who aren't so young anymore, about how to really use these platforms in ways that are engaging. I think you all have a much more capacity around doing that. And so I think, as we've stated in our recommendation, centering young folks like yourselves and centering other young folks out in community, particularly young folks who come to this subject with some skepticism and are given the information they need in order to eliminate that skepticism. I think those are the folks that really can help us develop the messages we need.
Thank you, Roberto. Yeah, Randi, from a perspective of a young adult yourself, as well as, working closely with Rafiki, which is a big, very important for us in terms of disseminating our information. What suggestions do you have for creating that balance with social media?
Yeah, of course. Thank you. So I do think that social media is very powerful. It can also be very detrimental if not used correctly. I do think that it is important for community organizations and institutions to definitely keep up with the times, and we need to adhere to how our community likes to communicate and how they like to receive information, and that is through social media. Social media is very accessible to a lot of folks, as our phones allow us to download apps, and it becomes a part of the daily routine to just naturally hop on and scroll. And so I think that the information that we do put on social media can be very powerful. And also making sure that the information is interesting and also answering the questions that people have. It's not really beneficial for putting information out there that is not answering the questions that our folks have. And so it is important for us to really, use their questions, use their concerns to bridge the conversation between us as a community-based organization and the community in itself.
Yeah, thank you so much. And Kirsten, I don't know if you have anything you want to add in regards to the use of social media and maybe how, NICOS has been using that, or how you generally use it.
So we all know that social media is pretty powerful in transition age youth. Like they focuses on the how many likes or how many thumbs up they receive, and they kind of use that as a which is, I don't agree, but they use it as a tool to measure if that information is true or not. They use how many likes they receive, to decide, oh, I think so many people like this post, so it must be true. So I think we need to change their way of thinking what social media really, the information on social media, what it really is. And also I feel when we work on, maybe in the future, work on the influencer to create more powerful social media posts to the transition age youth, we have to keep the information that we share in mainstreams is this consistent with the information we share on the social media. Because in our focus group, they kind of they build up the mistrust because they feel they are confused. So there's a confusion caused by the difference. So one of for example, they don't know if they should trust the mainstream news or the social media news, because the news shared on those two platforms are totally different sometimes. For example, they talk about they saw some social medias posts that are vaccines contain microchips, or maybe influence the fertilizations, or even they fear about the zombie consequence caused by the vaccines. So they hesitated first, right? But then they ask what if that's true after seeing more and more similar posts on the social media. When her niece shared those zombie informations on the social media to her, she said let's get some when we post something on the social media, we need to put it as interesting to attract them to consider views on it.
Yeah, thank you, Kirsten. And I think that's really interesting, and a lot of what I heard as well in our focus groups, just about the amount of information that's out there and just how contradictory it is. And so I think that's a really great point to tease out. And so I want to look to our next question. Mimi and also all of us in this conversation have talked a lot about the mistrust that we're hearing from these young adults and the effects that that has on the vaccine uptake. So I was wondering if you all could speak to what drivers of you heard when speaking to these young adults were present for mistrust. So like, what was really driving this mistrust? Was it historical, current? Where is this coming from? And for this question, I'd love to start with Randi.
Yeah, thank you. So mistrust was a large part of our conversation and our focus group with these Black and African American young adults. I would definitely say the history of medicine and the history of America in itself. We have been dealing with racism as a pandemic forever. And so there is a huge sense of lack of trust between our communities and medical and government institutions. And so one thing that was discussed was incentives. That was a huge driver of a lack of trust. Although I think when that was initially enforced, that was not the goal, but based on conversation, that definitely increase the lack of trust, because a lot of our participants felt like, where did all of this money come from? Why are we being like begged to take this vaccine? It is being forced against us. It just seems very unnatural at this point, and we feel extremely controlled. And so, you know, the conversation came up of, so if there is money to pay people to receive a vaccine, how come that money has not been used to address a lot of the other social issues that we have? You know, the cost of healthcare, homelessness, food, insecurities. There are so many issues in the community that we have been crying for help, and lotteries and money and tickets to games and just a lot of different prizes were being given out to receive this vaccine. And that definitely made a lot of people feel like this is just ridiculous. And also, some of our participants felt like COVID was being glamorized, the vaccine was being glamorized. It was mentioned in our conversation how we go on some social media, there are different filters to show like, oh, I've been vaccinated, or different filters created around COVID-19 that you could place on your profile pictures. And it just seemed to become really like commercialized, and that caused a lot of like distrust in our community. And so, you know, as Kirsten mentioned earlier, a lot of the information that has been put out there on the news and on social media and different conversations, it's kind of hard to know what's true, what's false, who do we trust? Because we don't have much trust in the government, but, you know, at the same time, we are concerned for our health a little bit. And a lot of folks also kind of had a lack of trust because they felt like, you know, I've been okay all of this time. Why can't I continue to do what I'm doing? Why do I need to inject something in my body that we're not sure of the long-term effects? Some of our participants mentioned that they wanted to wait 2 to 5 years to see the long-term effects on the folks who have already received the vaccine. And they were very adamant about not wanting to be used as a guinea pig or as a lab rat, and did not want their body to be used as a science experiment.
Yeah, thank you so much, Randi. I mean, those are really a lot of amazing insights into what's kind of behind this mistrust, specifically in this age group, and specifically for the young African Americans that we spoke to. Roberto, I'd love to hear your reflections on that and your perceptions of what was driving the mistrust in the focus groups that you were a part of.
Yeah, thank you. So as I mentioned earlier, I really do think that the political moment we all experienced recently was had a dramatic influence on many of us, right? But in particular, I think young folks who for the first time are voting, for the first time are engaging or paying attention to the political scene, and seeing a president saying, don't trust the electoral system, don't trust what government officials are telling you, don't trust the scientists, don't trust the media. I think that's a pretty powerful message, especially for young people who are beginning to form their opinions, their political opinions, their understandings of government. So I think that's one piece. I think the other piece of, as folks have mentioned, there's a tremendous history of abuse, neglect, structural oppression on the part of the entire research enterprise, the enterprise of medicine. There are certainly many committed people working hard to advance health equity, working hard to advance social justice in these fields of research and medicine. But that history lingers, right? And so we did hear from folks, they want to, as in our findings and recommendations, they want to know what we're doing now around social justice and health equity, right? They don't want to be told to just trust the science. They don't want to be told to just trust UCSF or the Department of Public Health. They want to be told, what is UCSF doing today for their communities, for low-income communities of color? What is DPH doing today for low-income communities of color? What are the community-based organizations that are engaging them with health education doing today? And I think that's really important. Folks want, rather than shallow statements and taglines, they want to hear the real tangible work that we're doing to impact their families' lives, their community lives. So I think, those are other pieces of why the tremendous amount of distrust. And then, of course, there's a lack of information. How was this vaccine developed so quickly? I happen to know, we know, because we have access to that information. Not everyone has access to information that describes that, actually mRNA vaccines have been in development for a decade, right? Not everyone has information about Operation Warp Speed and the tremendous amount of money that was funneled into the development effort by our nation and many of the powerful, wealthy nations in order to reserve vaccines for us and for those other wealthy nations, right? And as folks have mentioned, if you're not providing free diabetes care, free cancer care, why would you pay me to take a vaccine, right? So folks want to understand, what's the profit motive behind that, right? Is it because, the government doesn't want to shut down the economy again? Maybe it is. We should talk about that, right? Young folks want frank, candid conversations about this, and I think they deserve that.
Absolutely, absolutely. Thank you, Roberto. For those comments and just for sharing all that information about the mistrust, which is really interesting and quite different from some of the mistrust that we heard with the older adults. Kirsten, would you like to speak a little bit about the mistrust specifically in the AAPI groups and what?
Yeah, sure. So I think when I talk about mistrust, can you all hear? So when I talk about mistrust, I will focus more on Samoan community members, because the Southeast Asians participants, they have more trust on the vaccines and also the information shared by the mainstream's platform. So we will focus on the mistrust developed in the Samoan community members. So I think the most part, the mistrust is driven by the misinformations shared on the social media, because they really depends on the social media. That's their way to collect the informations. Another is as Roberto mentioned, the structural oppressions, because for Samoans populations, they are a pretty small, marginalized, vulnerable API groups, and they have encountered so many structural oppressions. They have a lack of access to resources, so they don't develop the mistrust when they during the history of having this institutional discriminations or systematic oppressions. So we need to really pay attention on when we focus on API groups, we need to remind ourselves all the time what kind of API group we miss in the umbrella of AAPI, right? So that's the thing that I want to add on.
Absolutely. Thank you so much. And you're actually bringing up a topic that I'd really like to talk about and get a little bit of information on. So just for those who maybe don't know the context, in our earlier focus groups, we focused on Chinese and Chinese American individuals. But for the young adults, we had more of a problem on Pacific Islander and Samoan individuals. And so I was wondering if you all could speak to what led to that decision, and then also how we disaggregated our data. Was it completely disaggregated? did we just, create big statements across the board for the AAPI group? Yeah, just talking a little bit about that distinction. And Kirsten, I'd actually love to hear from you first.
Yeah, sure. As I mentioned previously, so South Asians population, they may trust the official agencies more. I think like it really depends on the culture. They develop a culture like officials means of authority. They trust them more. The information shared by authorities must be the truth. So that is culture is one of the factors. And also I felt like in Samoans community members, it's some of the structures oppressions they encounter, and also they have like developed a sense to challenging the system. They dare to challenge the system. They want to challenge it. I think it's depending on the education that you receive. You were educated to dare to challenge the system. Don't be afraid to fight for the oppressions. So that is one of the cultures. So I think like in the future, when we do the outreach programs, or when we need to work with different AAPI population, we really need to focus on the develop a culture humility, and also build up a sense of a culture sensitive. We need to realize the difference between different AAPI populations. When we kind of like put all AAPI groups under one umbrella, actually we are creating oppressions on those more marginalized population, like Samoan or maybe Filipinos population, right? And also I feel like there's another difference why Samoan community developed that more mistrust is because like they have less resources, they have less access to build up the well-being of the community. They are more struggling. As one of my Samoan participants mentioned that she said like there's higher rate health disparity insisting in Samoan community because they are the most marginalized API groups. And she even mentioned like when the pandemic hit, her Samoan client doesn't even know what happened at all because they do not have the resources. The resources that for API population may translate it into Chinese, Japanese, Korean, but maybe not really much resources translating in their language Samoan communities need. So I think that's the point. And also I feel like in the future, when we have the conclusions or the findings, we need to focus on what kind of similarities for the whole API population, why we also need to emphasize the difference into different API groups, so they will have like more specific way to access the resources they want.
Yeah, absolutely. Thank you so much, Kirsten, for pointing out just, the importance of acknowledging that there are so many sub-racial and ethnic groups within each of these larger categories that we're focusing on, and, the importance of disaggregating that data to create sort of more targeted outreach. I don't know if Roberto, you'd like to add anything regarding the limitations of our ability to disaggregate or not disaggregate the data and what that meant for our analyses.
Yeah, so that's a regular challenge in research and in trying to address health disparities. I think, for example, we found during the course of this research that the generation of immigration was really important, and we didn't, track that when we did intake of folks to participate. So whether someone was recently arrived, first generation, or here multiple generations, we noticed in the conversations there seemed to be some differences of opinion, particularly early on when folks who were immigrantes in the Latinx focus groups expressed some hesitance based on fear of retaliation with regards to their immigration processes. So fear of surfacing themselves if they were undocumented, or fear of having something on their record relative to accessing public charge and having that damage the possibilities for them naturalizing in the future. So I think, certainly people's status around immigration is something important that if we disaggregate that data has meaning to what folks think and perceive relative to their ability to access resources or even relative to whether to how much they trust or distrust, right? I mean, I know in previous studies, not this one in particular, but in previous studies, we've seen where native-born Latinos born here are much more likely to distrust government in ways that are very similar to the African American community, whereas immigrant folks coming in see this as sort of a land of opportunity relative to the experience that they're fleeing, right? So I think that's important. And then of course, with the Samoan community, we're very fortunate to have our partners at NICOS reach out to our partners at Samoan Community Development Center to bring in the voice of Samoan young people in particular. But what we didn't have ultimately, which I think is a limitation of our study, we didn't have Samoan leaders at the table with us analyzing the data in the same way we had folks from Chinese, African American, and Rasa communities sitting with us at the table, helping to analyze what we collected, what we learned. And so that should also be stated. And I think that is also a piece of what happened relative to engaging multiple communities that are API.
Thank you so much, Roberto. And for also talking about, the importance of disaggregating that data by immigration status and other factors that affect different communities. I think in the interest of time, I'm gonna skip you on this question, Randi, but I'd love to hear a little bit more, and this was a question from the chat, about the importance that ethnic news media plays in each of these communities. And I'd particularly like to hear about, the importance that ethnic news media plays for the adults we spoke to earlier in the year as compared to the younger adults that we spoke to recently. And maybe Randi, you want to start for this one?
Yeah, that's a really good question, actually. A lot of our conversation, it really wasn't specified around ethnic news media, but I definitely do think that there are figures in our communities that do have really strong voices and that our communities do look up to. At the same time, I think it is a little bit tricky on the media side because the factor of money, and I think that I've seen a handful of folks who are, not so comfortable talking about certain topics because they don't want their figure to, be at risk, or they don't want to lose their power in the media or their standing or their followers, or get bashed on the internet or on whichever social platform they use. But I definitely do think that, amongst our different communities, there are different figures that people do look up to, and their voices are really powerful. And so I would love to further look into that topic of ethnic news media and specifically how it has influenced and affected COVID-19 and conversations around the vaccine.
Thanks so much, Randi. And Kirsten, I'd love to hear from you, since you spoke about just the importance of maybe having more language concordant outreach or outreach specifically to the Samoan community. What is the importance of ethnic news media?
I think the ethnic-based media organization is pretty important for Samoan population or even other API populations. They will build up trust when they see the language that they're familiar with, or the public figure they are familiar with. It will help them build up a sense of involvement, like community involvement, and it's different. When they have build up a sense of involvement community, they will. I think that will be helpful for them to be engaged in the vaccines, when they realize, then, oh, hey, I know that person, or I know that's just my cultures, and then they will just trust their cultures more when they sort of ethnic-based media organization, or social media posts that is aligned with their cultures and or their value.
Thank you so much. Absolutely. And I think we're close to wrapping up, but I want to hear from each of you on this last question. I'd like to hear, what's the one thing that you learned from these focus groups and conversations that you're going to take back to your organization to actually make changes in the way that you're outreaching to young adults regarding the vaccine. So, the main takeaway and sort of how you're incorporating that into your own work. And maybe Roberto, we can start with you on this one.
So I just responded in the chat to Natalie. It may be Natalie Asun, who's a partner of ours working in Samoan community and API communities broadly, with regards to her calling out, thanking us for acknowledging the limitation of not having Samoan leadership be a part of the analysis phase. So I do want to say, this is an affirmation for me, the process of this, doing this partnered research, an affirmation that it's always super important to have folks who are in community, who understand community, who serve community, who are reflective of community, who are trusted in community, be a part of engaging to learn what's going on in that community. So the fact that we had Rafiki Coalition, NICOS Chinese Health Coalition, Instituto Familiar de la Raza at the table was really key to this work. Samoan Community Development Center, super key. So for me, that's a takeaway affirmation of something that I learned before, and I'm learning more and more deeply every time I get an opportunity to be a part of teams like this. So I'm very, very thankful for that.
Thank you, Roberto. And Kirsten, I'd love to hear from you next. What is the one takeaway and that you'd like to share, and how are you incorporating that into your work in community?
I think it's that the influence of the social media. I also mentioned previously for this age group, they focuses more on them, like their feeling, like they want to do it, like instead of like they having a pretty strong social response, sense of a social responsibility. So I think like in the futures when we have the activities, I think it's good to involve more transition age youth into the outreach programs or other activities to try to increase their involvement inside this community. And also I feel like we need to collaborate with this age group more to collect their perspective or data from this age group, so we know their perspective and we know like what can to involve them into the policies making, or like another projects that can promote the social justice or improve the well-being of their own society. So which is like encourage them to work with the community, then that may help them to get more sense of like on the policies making, also like the policies program. So they will be more willing to take on the social responsibility in the futures, maybe.
Yeah, absolutely. Thank you so much. And lastly, Randi, again, love to hear, one takeaway and how you're taking that back to your work in the community.
Yeah, I think, this project was a good representation of how it is really important to take a step back and listen. As a community-based organization, it is important for us to have conversations with our communities, not having conversations talking at our communities, and to really incorporate their voices and their comments and their concerns and addressing them. I think that also it is important to consider that the vaccine is just one way to help slow the spread of COVID, and that other conversations are necessary, in terms of discussing other ways to boost your immune system and other ways to help stop the spread of COVID as well, instead of looking at the vaccine as the only way of slowing the spread of COVID, especially seeing the effect of the Delta variant and how it has affected those who have been vaccinated. And so also, I think it's important to have honest conversation. It is okay to say, I don't know. It is okay to let folks know that, we need to do more research and look for an answer because we don't have an answer, versus, walking around as if we just know everything. So I think it is important for us to take accountability when addressing if there is something that we are unknowledgeable about, and taking steps to, find answers.
Yeah. Thank you so much, just to all three of you for being here today, for your insights, for your partnership in this project. It's been amazing working with all of you and having this conversation today. I'm gonna push it back to Abby to do a closeout, but just like to thank everybody again.
Thank you again to Francine, Kirsten, Randi, Roberto, and Mariam. What I have on the screen right now is just another way to highlight where you can find our brief. If you go on our community partner site, rafikicoalition.org, on the main page, if you scroll down to what we offer, and this is just a screen grab of that, you'll see our 4 practice and policy briefs and our most recent for young adults. Again, I want to highlight a special thank you to our co-investigators and community partners from NICOS Chinese Health Coalition, Kirsten Liu, Kent Wu, Michael Liao, from Instituto Familiar de la Raza, Doctora Angela Gallegos Castillo, and of course from Rafiki Coalition for Health and Wellness, Randi Ellis and Dr. Monique Lassar. Our PI for this project at UCSF is Dr. Kevin Grumbach, and we just want to again thank you all for joining us today. I've included my email if anybody is interested in reaching out for more specific questions or to ensure that you do receive our recording. We just want to thank you again, and we hope to partner with many of you if you're local in the area. So thank you everybody today. Enjoy the rest of your afternoon.